In April 2017, we started to screen all new moms, so 6,500 to 7,000 women deliver babies here at Cedars-Sinai every year. And we're really proud to now be screening every single one of them 1 to 2 days postpartum for depressive symptoms. This may be the only time that they're ever asked how are they feeling, not just physically, but also emotionally. And here at Cedars-Sinai, we're very interested in changing really the conversation, or shifting the conversation away from depression and really focusing more on maternal wellness. That includes child wellness, and that really includes family wellness, the spouse, the partner. We want to focus on what can we do to help, and we can't know whether we need to help or not unless we ask the questions.
Welcome to the Perinatal Mental Health Screening Demonstration video. This training video is intended for nurses, physicians, social workers, and any healthcare provider who might screen for postpartum depression. As you prepare to screen patients, it's important to keep in mind some of these tips. Before you enter the room, take a breath and prepare to take emotional vital signs. Make eye contact, and if the patient is sitting, sit alongside her. When reading assessment questions, make sure she understands each question. Therefore, make sure to take your time, as it will only take approximately 5 minutes. Thank you for your efforts. They matter and will make a difference. Let's take a look at an example of a nurse practitioner screening a patient using the PHQ-9.
Come in.
Hi, Elva.
Hi, Julie.
Oh, you have some guests. Hi. How are you doing today?
Good, thank you.
So Elva, it's hospital protocol that I ask you a few questions while you're alone. Is that okay?
Is that okay?
Yeah, Mom.
Okay. Here's the baby.
It'll only be a few minutes and I'll come and get you when we're
Okay.
finished. So Alva, I just have a couple of questions to ask you this afternoon. There's a series of questions that we ask all new mommies just as they are trying to adjust to their new role of motherhood. These questions will inquire about how you've been feeling within the last 2 weeks.
Okay.
Some of the questions may make you feel uncomfortable, but my goal is to support you so that you can be the best mom that you can be.
Okay. But if I'm not feeling well at all, are you going to tell Child Protective Services or my husband?
I'm so glad you asked that question, Alva. Just to let you know, we do not share the questions with anybody else, including your husband. But if you feel that you're going to hurt yourself or others, we will let a mental health professional know.
Okay.
Okay. I'm going to start with a series of 9 questions. 0 is not at all. 1 is over several days. 2 is more than half the days. And 3 is nearly every day. So I'm going to start with my first question, and it starts with, over the last 2 weeks, have you been bothered or having little interest or pleasure in doing things?
Several days.
Several days? Okay. Over the last 2 weeks, have you been feeling down, depressed, or hopeless?
Yeah, a lot.
A lot?
Sometimes.
More than half the days?
Sometimes most of the days. Half
Okay.
the days, yeah.
Okay, that's okay. Over the last 2 weeks, have you had trouble falling or staying asleep?
Every day.
Every day?
day.
Okay. Over the last 2 weeks, have you been feeling tired or have little energy?
Sometimes.
Sometimes. That's okay. Over the last 2 weeks, have you had a poor appetite or overeating?
No. I wish, but no.
Okay. Over the last 2 weeks, have you been feeling bad about yourself or a failure, or you've let your family down?
A lot of the times.
A lot of the times. More than half?
More than half.
More than half. Okay. Over the last 2 weeks, have been having trouble concentrating on things such as reading a newspaper or watching television?
No.
No, that's good. Over the last 2 weeks, have you had problems moving or speaking so slowly that other people could notice, or being fidgety or restless?
No.
No? Okay, that's great. Over the last 2 weeks, have you been bothered by thinking that maybe, it'd be better off if you weren't here or hurting yourself?
Oh, no.
No? Okay, that's fine. Thank you so much for your time, Alva. Just to, we're going to provide you with this pamphlet here that says, Speak Up When You're Down. 6 things every new mom and mom-to-be should know about maternal depression. So this is a great resource tool for you to have. In the front here, there's a website that you can follow up by just punching in your zip code, and they'll find nearby psychiatrist, psychologist to help you along your journey. Okay. We also have a social work on hand that can come by at any time that you would like during your stay here. Is this something you'd be interested in?
Sure. I'd like to see a social worker. That'll be great. But my main question is, I know that all of this is very natural, but I'm concerned, how do I know if and when I really need the help?
So that's a great question, Alva. I encourage that you trust your instincts, and if you feel that you're unable to take care of yourself or the baby, that is definitely a sign where you need to reach out for some help.
Okay. That's helpful to know.
Just to let you know, your obstetrician is a great resource guide outside of the community as well. You'll be following up with him in about the next couple of weeks, which is normal. We encourage that you reach out to him, in those next couple of weeks and let him know how you're feeling, if not sooner, if you feel you need help sooner. Do you have any other further questions for me at this time?
No, I'm okay. Thank you.
We're here for you at any time, and again, the social worker is going to probably pop by a little bit later and do a visit with you. At this time, I'm going to ask that your mom go ahead and step back in and visit with you. Is that okay?
Okay.
Okay.
Thank you.
Remember, a yes to item number 9 always requires additional questions. When asking more about suicidal ideation, it's important specifically to ask if she has a plan and a means. Inform her medical care provider that her PHQ-9 score was high and or that she endorsed some suicidal thought. Make sure to talk about protective factors, what keeps her safe. Follow your hospital safety protocols and use common sense. Don't let her leave the hospital without talking to someone. Postpartum depression is prevalent and can impact all women and families. Screening is an important way we can help women and families get the help they need. With the right help, families can thrive.
But often it's difficult to even know if a patient is depressed because they don't volunteer that information. So when a patient has a routine screening, it helps to give the nurse kind of as the original point of contact to just alert us to let us know, hey, this patient's having a little bit of trouble and she might need a little bit of extra help, which allows us to then go in and speak with the patient. And if they do, in fact, elicit a history or feelings consistent with postpartum depression, then we can help to facilitate in a quicker process to get them the help that they need. Whether that means just getting them in contact with a social worker to help provide them with resources, versus getting them in contact with a clinical psychologist outpatient, versus all the way to the top where we need to contact inpatient psychiatry and help to manage them here. Everybody is more than willing to help and to help get these patients the great care that they need.
It's tough because all we have is a really short window with these women, so we do what we can. As a mom and a mental health professional, I want to see these women succeed. I want to see them do well, so we do what we can. Of course, we're hoping that they're screened later on as well, maybe in their OB's office or pediatrician's office, but at least we're screening them. Some patients are screened before they deliver, either in the maternal fetal care unit or maybe somewhere else, but if all are screened afterward, then some of these signs might show up early on and we're able to catch those women. Patients seem to be open to it, especially because it seems as though it's just part of the routine questions that the nurses are asking now, so they don't seem to feel targeted or judged. It's just routine. And if they happen to score high and the nurse is going to be calling me to come and visit them, the nurse usually gives them a little heads up and briefs them on what it is that I might talk with them about. So they usually seem to be pretty open and welcoming.
So I would have loved to have known where I stood if emotionally I was just feeling very normal things, or was it something that I really should look into to help myself? It would have been very nice if there was some type of method that would check in with me, but not just me health-wise, but me emotionally, which is the most important.